The four major problems in orthopedics is the fractures, the osteoporosis of the bone, the joint injuries and joint problems, and then tumors in the bones, and the tendons or soft tissue issues in the bones. These are the major problems. Obviously, we should treat accordingly. The osteoporosis is nowadays the middle and above aged disease, which must be treated early so that the complication should not develop. The fractures, whether it's a simple or a compound fracture. The simple is the fracture within the skin. The compound or complicated is the fracture which is exposed to outside the skin. So in that fracture, you should treat properly so that whether it's a conservative treatment or surgical treatment, you should be taken care. When there is a dislocation in the joint to be reduced immediately so that the pain, one thing which can be relieved, and then there is a complications like nerve injury and veins, blood vessels injury can be avoided. The dislocations will be dealt as early as possible. And then bone tumors, you should, whether it's in a cancer bone or that it's a non-cancerous bone, to rule out and treat it accordingly. The nutrition for the bone is most important to increase the strength, like quality, quantity of the bone. If not, then the problems will arise. Obviously, when the normal nutrition like balanced protein, fat and carbohydrate associated with the good amount of green vegetables, green salads and the green vegetables, and then you should have exposed to sun so that the vitamin D can produce through the skin in the form of cholecalciferol. Vitamin D can be produced only by sunrise exposure to your skin. And then there are the artificial vitamin D supplementation, cholecalciferol supplementations, but the sun exposure is most important to reduce the osteoporosis disease. And then when you know that the calcium products like milk, green salads, green vegetables are good enough to give sufficient or maintain sufficient calcium in the body, you can put supplementation if it is deficient, about 500 to 1000 milligrams per day. And then the minerals which you can get through the various foods and then water, like potassium, magnesium, manganese, and then electrolytes, to be maintained proper way to avoid the osteoporosis disease. So these are the various conditions where we should give a proper nutrition to the bone, and then do a regular exercise to maintain the circulation, strength of the tendons and muscles so that the bone strength can be increased. So regular exercises is most important, and proper nutrition is most important to maintain the quality and quality of the bone. Like bone density could be maintained proper way.